Welcome back to 12 in Our Schools. I'm your host, Brian Jenkins. Here's a little food for thought. Attention deficit disorder, or ADD, is often diagnosed when kids display inappropriate attention, impulsivity, and sometimes hyperactivity in connection with their mental and chronological age. And with me today to talk about that is the head of let me get this right, Dr. Leonard Press, the president of the New Jersey Society of Optometric Physicians. That's a mouthful, doctor, but I want to make sure I get that right. This is something that doesn't often get diagnosed and presents itself as problems in the classroom. Now, let's talk first about how you recognize it. What little things can teachers and parents use to identify this in a youngster?
Probably the most common observation would be some disconnect or missing link between the child's ability to listen and comprehend, or to identify words in word lists, let's say, but not to have any kind of a fluency or ability to sustain attention while reading independently.
Okay, so this is not a kid who necessarily has a mental disorder per se. This is a vision disorder.
Correct. They're fully capable of comprehending. Their intelligence is at a normal level. And for some reason, when they have to use their vision independently, they have a lot of difficulty staying on task.
Now, that's interesting. You mentioned independent vision. You got some things that we can use to show parents how to measure things like that, and something you call vision therapy. What is that?
First of all, in understanding vision therapy, we have to put aside the idea of 20/20 eyesight on an eye chart being normal vision. It is normal and good eyesight, meaning you can see things clearly, but there are a lot of elements of vision that go way beyond eyesight that have to do with reading.
So you can have 20/20 vision and still have ADD?
Absolutely.
Okay.
And not every child with ADD by any means has a vision problem, nor does every child with a vision problem have ADD, but they coexist in about 1/3 of all cases.
Interesting, interesting. Now, you've got a model of the human eye. Can you give us the basics of what's going on inside there?
So many of us are familiar with the eyeball and general eye movement, but the outside of the eyeball, what we call the cornea here, does about 2/3 of the job of forming what you see, but there's an important little structure in the eye called the crystalline lens that does about 1/3 of the job, the fine-tuning. When you're young, you have a lot of focusing power, and we just take it for granted that when you look up close, you input the right amount of power and you can sustain it for as long as you need to. And some children have a lot of fluctuation in their ability to control this focus.
There are muscles around that piece that determines how well you can see.
There is a muscle inside the eye that controls that focus. There are also muscles outside the eye that guide movement. And you have two eyes. So we have to make sure that the two eyes are aiming at the same point at the same time, and that's where your eyes are meeting. That isn't always the case. So if you're looking at a book and the two eyes are not keeping up with each other, big trouble.
Now, you have an interesting test here with this string. What did you call that? The
Brock
string. Yes, let's take a look at that to our viewers, because this is something that you can even do at home to get an idea of whether your kid has an issue with vision.
Correct. A little screening test, and a doctor can probe this in more detail. You'd wrap this over your index finger.
Okay, like that.
And hold that right between your eyes, a little bit lower on the bridge of your nose.
Okay.
And as you're aiming toward the green bead, let's say we put this at the distance you'd normally read, you should see how many ropes there.
The two ropes should come together?
And they should meet exactly at the green bead.
Okay.
Now, if you're having trouble with using both eyes together and you wink one eye shut momentarily, what happens?
One disappears.
One disappears. So both have to be on at the same time. If you have a condition that we call convergence insufficiency, a problem aiming both eyes here, your crossing of the ropes will tend to occur at some point beyond instead of there.
Okay.
And it's something you can work at and improve.
Interesting, interesting. So that's something that people can do just kind of at home, just to kind of get an idea.
It's a very good screening tool.
Now, you have tools that go beyond that, some computer programs you talked about.
Right. There are computer programs that can be done at home, again, with guidance, where a child is wearing red-blue glasses. Part of the screen is seen by the right eye, part by the left eye, and part by both together. It's almost like virtual reality and video game-like. So children love working at it, and it enhances and develops eye tracking, focusing, and eye teaming.
Now, is this something that the parent, that schools are aware of, that a parent can go and say, well, look, my child's having a problem, what can you tell me? Is this something that you've contacted schools about? Are they aware of this, school nurses, or are parents pretty much on their own?
Our state association, the New Jersey Society of Optometric Physicians, has guides for school nurses, has materials available for teachers that can be taken off our website. I think most parents still identify with what's a screening rather than examination. And a school nurse is mostly going to test in school for eyesight problems, not for eye tracking problems.
Interesting.
So we're all familiar with the typical eye chart that's on the wall or in a pediatrician's office, but there are actually other charts and activities that have a lot more to do with sustaining attention when you read.
Now, you have one of those charts. Let's talk about what goes on there.
So we'll take a little example, and I'll have you work through this.
Alrighty.
Let's have you just track the first letter and the last letter on each row, so you can call it out loud.
Okay, so O-E, Y-X, E-P, B-C.
Excellent.
Okay.
Go to the second letter in and second from the end.
F-H, B-R, T-A, X-V.
Feel yourself slowing down a little bit?
Yes.
Third letter in, third from the end.
N-C, A-L,
whoops.
H-K. It gets more difficult, right?
Why is that? Why does it get so much more difficult? Same size letters, has nothing to do with your eyesight. We'd agree you see it clearly, but as material gets more crowded, you have to work a lot harder to keep your place.
So it's tracking.
Tracking. You may do well, in first grade with larger print books and pictures breaking up the print, but when you get the chapter book print, some children have a